Hi there, I'm Luke Adams and I work with the Mind-Body program at San Francisco City Clinic. We offer support services to clinic patients who might be facing life stressors and can use someone to talk with, or get some tools and connections to more resources. Our aim is to support exploring and maintaining healthy behavior choices. For some, this could include stress around substance use. For others, it could be concern around sexual health and risk factors, or it could be about social support and the ability to have healthy relationships. Our services are free. We want to make sure that HIV-positive people stay healthy and suppress their virus, and that HIV-negative people stay negative. The Mind-Body program helps people come up with the best strategies to live at a level of risk and harm that seems safest and most sustainable for them. Sometimes we see stress around the connections between substance use and our sex lives. Here's our top 10 list on how to disconnect that pesky link between drugs and sex. Number 10, do not give up. There are small incremental ways to reduce harm by limiting your use. For example, try enrolling in treatment and getting mutual support. Keep at it and keep moving forward. Number 9, take your own sexual inventory. Examine any fear you may have of intimacy or rejection, and any attitudes you may have toward others or yourself that take away the value of sex. Ask yourself, what do you want out of your relationships? And decide if these standards are realistic. Number 8, know that it's normal to have little or no sex drive when discontinuing drug use. This too shall pass. For most people, it can take several weeks to months for their sex drive to kick back in. Your brain chemistry may not even return to baseline for 1 to 2 years, so expect you will be working on this for a time. You are probably going to feel frustrated and afraid that sex without drugs will be boring and unsatisfying. However, number 7, keep in mind that enjoying sex without using drugs will take some time and practice. You may want to consider developing 1 or more safe-feeling friendships with whom you can practice. Number 6, get creative, get active, and just get out. A moving target is harder to hit. Develop a list of alternative activities to do immediately when confronted with urges to act out in ways that would potentially combine sex and drugs. Number 5, be prepared by bracketing around your sex and romance life with recovery tools. Understanding the stuff that gets you to associate sex with drug use is one big part of knowing how to address it. Develop an action plan to anticipate and respond safely to your triggers. Number 4, chill out and take a time out. Consider taking a cooling off period from sex for a short while after your last use to let your thoughts, feelings, and fantasies wind down. Some people say 30 days works well for them, but be careful of restricting your sexuality so much that you might binge in an unhealthy way. Number 3, find strong support. Do you have a therapist, a group, a sponsor, or friends you confide in? Be open and honest with these supporters about your secret desires of potentially combining sex and drugs and wanting to use sex only for seeking validation. Number 2, be open and honest. Talk with people about your thoughts and concerns about not being able to engage in the kind of erotic sex you want without getting high again. Don't be afraid to dispute yourself about these thoughts. Ask, what do you really want out of sex? And what sexual behaviors do you wish to keep away from to enhance your life and recovery? Number 1, expand your support system. Work on finding, caring for, and nurturing a social and mutual support system to which you can turn. So, for more information about the Mind-Body program, you can contact me at San Francisco City Clinic at luke.adams@sfdph.org, or you can call my office at 415-487-5510. Thanks.